Hello there, you're watching Debrief on CNN News 18. I'm Maha Siddiqui. India has crossed another grim milestone of over 2 lakh COVID infections being registered in a single day. What's worse is the high number of active cases, close to 14.5 lakh at the moment, currently an overstretched healthcare infrastructure. Why is the second wave more dangerous and how can we tackle it? Over the next half an hour, we hope we can help you understand the new nature of the virus and how you and I should remain more alert to its cunning ways of penetrating our body. But first, the biggest concern at the moment is that there is a new strain that is dodging the RT-PCR test. What does that mean? A COVID patient may get a false negative test, assumed to be well, but wouldn't be. And by the time known symptoms appear, the body would have already been hit by the virus enough to make the recovery a long-drawn process. Not just that, in the silent period of the virus going undetected, several could be infected by the one single patient. Natasha Menden explains just how the mutant got more wily.
There's a new mutant on the loose, and it's meaner and sneakier. We already know that the mutant strain is more infectious, but now it's found a new hiding place, your lungs. The gold standard of testing, the RT-PCR test, is failing to detect the virus. Hospitals are reporting patients coming with symptoms and testing negative for the virus, sometimes twice or thrice. Such patients can be highly contagious and can go on to spread the virus. So what do you do then? You have to get a CT scan of your lungs. Patients with fever, cough and shortness of breath showed grey patches, medically known as patchy ground glass opacity. The other option is to get a bronchoalveolar lavage. A scope is passed through the mouth or nose and then collects fluid for examination. So why is the RT-PCR test, once the final word on COVID testing, suddenly inadequate? Doctors believe it's because the mutated strains sometimes don't colonize the nasal or throat cavity from which swab samples are collected. Instead, the virus attaches itself to the ACA receptors, a protein found on the surface of many pulmonary cells, which is what leads to the patchy opacity that shows up on CT scans. The virus is getting smarter and constantly evolving to evade our tests and medicines. Currently, vaccines don't have a great strike rate either at them. The only way to keep this mutated virus at bay is to stay away and mask up. Natasha Menden and Nitangshu Bhattacharya for CNN News 18.
Well, and with the new strain come the new threats of symptoms that you may not be able to identify for COVID. Watch this story now for the new symptoms being reported by patients. The more aware we are, the faster our response will be to the crisis. So here you go.
As states gear up to tackle the second wave of COVID, the symptoms have changed quite a bit. While asymptomatic patients were high in number earlier, more and more patients are showing symptoms during the second wave. Severe muscle pain, diarrhea, stomach pain, eye irritation and fatigue are among the most reported symptoms as of now. Doctors are reporting a mixed bag among patients showing symptoms. Many have several symptoms but no fever. Other symptoms also include irritation and dryness in the eyes. While in the first wave, loss of smell and taste were the biggest indicators, doctors say these are not really the most obvious signs this time around. Instead, patients are facing muscle pain and a loss of appetite. Much of the second wave can be attributed to the new variants emerging from all across the world, which are not only more contagious but also more lethal. With the current second wave spreading like wildfire, it's important to remain as vigilant as ever. If you experience any COVID symptoms, stop going out or meeting other people and seek immediate medical help. Bureau Report, CNN News 18.
Joining us now is Dr. Bagai, who will help us understand how to tackle this second wave of the pandemic. Dr. Sanjeev Bagai, many thanks for speaking with CNN News 18. First of all, sir, how often are we seeing these peripheral symptoms that one can categorize them in, for instance, eye flu or abdominal pain? which many people are experiencing, can they be used as clear-cut symptoms in the present conditions of COVID?
Good evening. So the second wave is the presentation clinically is a lot different from what we saw most of the patients which have come in the last year. One of first and most important is we've seen a huge surge in children below the age of 18. The youngest patient which I have seen with COVID positive is 8.5 months old. We never saw this last year because we always were given to understand that the children are generally spared. And the reason is on the interleukin levels, which run different parameters. Without going into the details, the protective interleukins are now in the second wave much lesser in children, and the time which it takes from the ACE receptors of the nose down into the alveolar type 2 cells is a lot shorter. So children are presenting a lot earlier with respiratory distress and syndrome, including multi-organ inflammatory disease, what we call as MIX. The second important part of presentation clinically is a lot of patients are coming with peripheral vascular complaints in which there is coldness, numbness, rashes, conjunctivitis indeed, joint pains, muscle pains, loose motions, abdominal gripes, vomiting. So if you have a mixed bag of these symptoms, because very often it's overlapping, I think it's important to bring it to the attention of the doctor and get your appropriate test done. The last most important point is what's happening with these mutations. Mutations is a very roughly used terminology by a lot of people. It's mixed up with the terminology of strains, mutations, substitutions. The long and short of it is the amino acid sequence changes in these evolving viruses of this RNA. And what these mutations do is it makes it more latchable, more binding to your ACE receptors. Till last year, we understood that there were just one ACE receptor where it bound. Now we know there are 28 different sites in the body where this particular virus can latch onto. They are known as scarf receptors and binders. These enter the nose and the mouth, come into the lungs, and then the rapid inflammatory process which takes place, which is cytogenic storm. These mutations are more rapid in onset, they transmit more quickly, they cause more infection into disease, more critical cases, and two important points in the end. One, you can indeed get a vaccine escape mutant. And second is it can escape the laboratory diagnostic test, which is of RT-PCR. And these mutations, especially the one which we are seeing in Maharashtra, what we call as a double mutation, which is EKQ485 and NY532, they happen simultaneously in an area of the receptor binding protein. That's your main part of your S protein of the virus. And in that there's a subpart known as receptor binding mofetil. So when it's in the critical area, it tricks the test. So it's unable to pick up the spike protein, and you feel that your test is negative, although you may be harboring the infection.
That's what's happened to quite a few people, and they have in fact been carriers, also then spreading the virus to other people. Dr. Bagai, do stay on with us, because now we'll take the question of why, despite vaccination, some people are getting the infection. Also, why is it not being able to stop the spread of the infection? Well, the third phase of India's vaccination drive is underway. Close to 10.5 crore doses have been administered, but reports of those being vaccinated and yet getting reinfected are also coming in. So what's being underlined clearly is that a vaccine will protect you, but only 70 to 80%. So, and also the fact that it will not let your infection become very severe so that you end up in a hospital. So you must keep in mind that even when you get vaccinated, to stay away from the infection totally, you need to maintain social distancing and mask up properly. Meanwhile, despite vaccinations, why are the numbers going up? That's because 70% of the population needs to be vaccinated to reach herd immunity. Here's a quick explainer.
vaccine is an antigen. When the antigen goes into the body, it generates antigen-antibody reaction. It will take some time to get the significant amount of antibodies so that it can protect our cells. In India now there are two vaccines. One Covaxin, and second is Covishield. In Covaxin, when we get 2 doses in gap of you can say 4 weeks, after second dose, you can add more 2 weeks to get the significant level of antibodies. And now in the Covishield, now the Ministry of Health and Family Welfare has increased the time period of 4 weeks to 6 to 8 weeks for the Covishield. So if you get second dose in 6 weeks, you get the antibody level high in after 8 weeks, after 2 weeks of the second dose.
All right, so why should one get vaccinated? That's the question many people are asking. If the virus is changing its nature, will these vaccinations be good enough? Dr. Sanjeev Bagai is still with us. Dr. Bagai, can you answer that question for people who are now concerned and raising questions about vaccinations?
Yeah, that's a core point. So what's the purpose of vaccination? Now, vaccination, we know for the last 100 years is the most time-tested and the most effective public intervention tool which we have, not only for epidemics, but also for pandemics. A vaccination is not to eradicate a particular disease rapidly. It takes time. Therefore, when a vaccine is given, it does not immediately stop the transmission. What it does is, in human beings, it prevents severe cases, critical cases, and it prevents death. Now, there is recent data as per yesterday which has been published. In USA, amongst the mRNA vaccines, the percentage chance of getting a reinfection after the 2 doses, fully immunized patient, is 0.0008%. That's minuscule. That means it's nearing 99.9% protective. We know that the vaccines have a particular vaccine efficacy. The vaccine efficacy ranges anywhere between 60 to 80%. But when you convert it to the on-ground effectiveness, the rate drops a little bit. Therefore, 5 or 8 or 10% will definitely be at risk. What is the risk period? Anytime, of course, pre-vaccination, anytime between the first and the second vaccine, and 15 days after the second vaccine. So from the start of the first vaccine, you have a reasonably good immunity by day 45. You have 2 types of immunity, B cells and T cells, and then the memory cells. The trick here is you have to continue to wear a mask. The reason is you may be partially protected, but the person who's next to you and both are not wearing a mask may infect you. And if your level of immunity is not adequate enough, you may actually manifest with the infection.
Dr. Bagai, Dr. Bagai, now I want your very candid opinion then on the vaccines that are available in India, their efficacy against the new strain versus the mRNA vaccines that you're talking about, which are Pfizer and Moderna. And there's one that is being done in India, but it's still a long way to go. Should we be then totally dependent on this adenovirus vaccine and the inactivated whole virus vaccine, and rather than try and get Pfizer and Moderna quickly into the Indian market?
There is no comparison between 2 vaccines. I've always said this for a very long time, that the best vaccine is the one which is first available to you and readily accessible to you. Both the adenovector-based vaccines of Covishield and Covaxin have a great, robust platform. It's being time-tested. They use a particular technique which is called as the Trojan horse technique, in which it piggybacks on the adenovector, on the chick adenovector, and it induces a very good, robust immunity. This immunity is sufficient for you to protect against the infection. But the complacency comes is when you stop wearing a mask when you go out. The important message is you have to wear a mask before the first shot, in between the first and the second shot, and indeed after the second shot also, till the complete community reaches a level of herd immunity. And that's a while away. So please protect yourself with a mask. Both the Indian vaccines are fantastic. I don't want anyone to feel that there is a comparison between vaccine A versus B versus C. All of them are showing excellent clinical results, and we will see the breaking of the back of this pandemic in the next few weeks, hopefully.
All right, Dr. Bagai, my final question to you. We've seen healthcare workers falling ill specifically in the second wave. Some of them largely have been given both doses of the vaccination. despite that they are falling ill. What steps can be taken now for protecting them? Because if they are not protected, none of us are.
So there's a recent news which has been circulating around, which is true, that a group of doctors in particular private hospitals and government hospitals, after the 2 shots, which they were fully immunized, did get the infection. But here is the data and the analysis. Amongst the group of people as doctors who indeed tested positive after being fully immunized, the protection against critical cases was 93 to 95%.
All right.
And 0 deaths. That means it is 100% protective to prevent deaths and 93 to 95% protective to prevent serious disease.
Right.
That's the usefulness of the vaccine. Imagine if these same doctors and healthcare workers were not vaccinated, we would have seen a very, very high mortality.
Okay.
Vaccines are extremely important.
Okay.
Both the vaccines in Indian diaspora are very robust,
All right.
very protective. There is no real risk. There is some myth going around with regards to the percentage of certain thromboembolic phenomena. That is extremely rare. I will not go into the percentages and the comparisons.
Okay.
They are only seen in young ladies who are on certain oral contraceptive pills in a very young age group, and there are certain medical reasons for it.
All right.
But rest assured, these vaccines are safe.
Okay, Dr. Bagai, many thanks for giving us your time there. I understand that all doctors are extremely busy at the moment, but many thanks for helping our viewers understand what they should be doing at this juncture when the second wave is upon us. Taking a very quick break now. Up next, the new COVID strain in India is also creating hindrance in India's engagement with the world. We'll tell you more about that when we come back. Welcome back. The new COVID strain has meant more infections in India. These are fast-spreading infections and look to be more contagious as well. Hence, New Zealand has now barred travellers from India to protect itself. The UK Prime Minister's office is also looking at reducing the length of his stay in India later this month. Clearly, COVID 2.0 is pushing us back into virtual diplomacy. As a mutant and more clever coronavirus grips India, its fallout is being felt on the global platform for India as well. New Zealand has barred the entry of travellers from India. This after the country that hadn't reported a single locally transmitted case in 40 days had 23 fresh cases last week, with 17 of them being brought in by those travelling from India. The bar will be in place till the 28th of April.
हमें ज्ञात हुआ है न्यूजीलैंड सरकार से कि उन्होंने 11 अप्रैल से 28 अप्रैल तक ये बैन लगाई है। वो कह रहे हैं कि ये टेम्पररी बैन है, क्योंकि और ये सिर्फ भारतीय नागरिक नहीं, न्यूजीलैंड के नागरिक पर भी लागू है। हम आशा यही करते हैं कि 28 तारीख के बाद ये बैन को हटाया जाएगा।
On the other hand, countries like Saudi Arabia are yet to lift a travel ban on Indians into their country. This has not been the only fallout. UK Prime Minister Boris Johnson's visit to India is now being curtailed due to the spike in COVID numbers in India. He'll be visiting for fewer days and will be going to fewer cities as opposed to a more extensive 4 to 5 day visit that was being planned earlier. UK Prime Minister Boris Johnson's visit to India has already been rescheduled once this year because of the COVID-19 pandemic. He was earlier supposed to be in India as a chief guest for the Republic Day parade, but at that time, the numbers in the United Kingdom were rising sharply. The situation seems to have reversed now, with India grappling with a second wave of COVID. And with the mutant virus now, the diplomatic protocols, which are routine in nature, have also been tweaked to some extent. So, the French foreign minister's itinerary was tweaked suddenly this week, and his call-on with the Prime Minister was dropped. Over the past 1 year, diplomatic engagements too have gone virtual, adapting to the new normal. And just when in-person visits had started, the new COVID strain has once again indicated. You've got to log in if you wanted to log out. Maha Siddiqui, CNN News 18. Well, that's it then on the show this evening. See you again tomorrow. Bye-bye.